of the Fisher Building of the Great Lakes. Good afternoon, everyone, and welcome to this special radio show with Dr. Doug Thompson. With over 25 years' experience in state-of-the-art oral health, he's here with us talking about the serious connection between gum disease and most of the major diseases of our time. Dr. Thompson will tell us about where his research has led him with respect to avoiding these silent killers. He's joining us today in this rare opportunity for you to call in and speak to him directly. You won't want to miss what Dr. Thompson has to say, and if you have a question for him, we're inviting listeners to call at 800-859-0957. So stay tuned, and we'll be right back after this short break. You're listening to 760 WJR. And are we on Facebook?
We should be on Facebook, yes.
Always on Facebook.
Hey, right. Thank you so much for
Dr. Thompson. Welcome.
Thank you for the invite, and thank you for having me here. You know, you mentioned on the intro major diseases of our time. You know, maybe what I'd like to do today is talk about how some of the things that we can see in the mouth can tip us off that somebody could either be diabetic or they could have heart disease. I saw a patient just this week, and the patient has what she thought was self-controlled, maybe some sugar problems, but like early, she thought she was pre-diabetic. Well, I got her A1C back from her labs this weekend, and her A1C is 13. 13, if you think about what A1C is, or if you know about what A1C is, under 7 is normal. 13 is very, very abnormal. She's a full-blown diabetic, and she's and not only that, but she's in kidney failure.
How did her PCP miss this? Let's find out.
Well, because sometimes they don't go to their PCP regularly, and I can tell you that in everybody's life, and I would say it's typically in the 50s, when you're in your 5th decade of life, could be in your late 40s, could be in your early 60s, but you get this metabolic shift where all of a sudden your body just doesn't process the calories the way it used to. And you get this metabolic shift, and what happens is you start to, your health starts to deteriorate, and one day it takes you by surprise because you think you're fine. And she actually had a problem with her vision, and that's how it was detected for her. But for me, well, you know, we knew that the gum disease was an issue. And we were already pre-tipped off. And I could have told her when I first saw her some years ago that she really needed to watch that carefully.
Siobhan, don't forget to push Facebook.
Yep, I will.
Let's talk about that when we start off, right?
Yeah, I think so.
So I think it's very interesting, right? Do you have that hooked up? Welcome to this special live radio show where you can call in with your questions and talk to the doctor directly. I'm your host, Anne-Marie Cronin, and we are here this afternoon talking with Dr. Doug Thompson, integrative oral health dentist from Bloomfield Hills, Michigan. He's here with us discussing his state-of-the-art clinic, the latest diagnostic systems in oral health care, and the importance of the connection between the mouth and many systemic diseases. If you have a question for the doctor on the matters we're discussing this afternoon, please call and talk to the doctor directly at 800-859-0957. Dr. Thompson, always a pleasure to have you here over the break. Obviously, we have listeners on Facebook. You were telling us about this patient that you inadvertently came to see you as a dentist, and you found all kinds of medical problems that would have been missed. And I'd just like to start off, if you don't mind, by saying she had a vision problem, which led her to discover the other things.
Yeah, sometimes what happens with people is that as they come in and we see them regularly, you know, we see almost all patients at least twice a year at a minimum. And the patients that have early disease, we see them 4 times a year. And sometimes when new patients come in, we can alert them, and we do alert them, and we say things like, you know, this is something that I really want you to watch for the future. And one of the things with this patient was your sugar balance. I mean, you're basically pre-diabetes, and it really starts with a condition called metabolic syndrome, which sounds kind of complicated, but what metabolic syndrome is, it's when you have a few things working against you, like you're already on a cholesterol medication. Maybe you're carrying a little bit too much body weight. Maybe your neck circumference is a certain size, or maybe you're on blood pressure medication. But you start to get a few things stacked on top of each other. And we know that since there's a bidirectional, which means back and forth relationship with 57 other systemic diseases now, we know that that patient, if they have some of these conditions, we already know that they could be just wait. Trouble could be just sitting there waiting for them. And so what happened with this patient is she kind of somewhat passed the gum disease test, although it was borderline. But what happens is, as patients age and as we go through life, there's a point in maybe our late 40s, early 50s, maybe even our early 60s if you're super healthy, where we get this metabolic shift. And all of a sudden, the calories that we process and the food that we eat starts to affect us differently. And it's harder for us to lose weight, and it's harder for us to maintain our ideal body weight. And, some of these other things that happen when we take in excess calories or we don't process the calories correctly, it upsets our blood sugar. And so she was starting to have a vision problem, and she went to a physician. And what did we learn? We learned that her blood sugar was way, way, way out of balance. And she was actually very sick, and she was actually starting to go into early kidney failure. So it's really, really a problem. And the nice thing is we could have seen that, and we did see that several years ago. And so we can alert patients of that, but we can't make them do anything. So that's what happened to her. And now I'm just waiting. I just got her lab results this weekend. So I'm waiting to see what's going to happen with her PCP, and then we'll work with her on her oral health and make sure her oral health is pristine.
See, the marvelous thing about your practice, of which there are a handful probably in the country, as I well know, is that I consider you to be a medical dentist. You've discovered something for a patient. And as you said while we were on Facebook Live and at the first segment here, things can change rapidly. You can be good at one point, and if you're not seeing your PCP for regular annual physicals, obviously it could be missed. So the good fortune of the fact that people hopefully will come in for dental exams is before you get into what's wrong with your teeth, you're starting with, you open your mouth and let me see what's in there. Because we're just finding out over the past few years that so many pathogens that are in the mouth outside of the normal flora are what causes these degenerative diseases and what lead to you actually getting, the disease itself. So it's a very fortunate position. Was fortunate for this patient, thank God.
Yeah, and it's really nice to be able to look at patients and help them discover other things about their health other than just the integrity of their teeth. I mean, we talked about it a show ago, and all these shows are archived on WJR.com, so you can go and look at it. But we talked extensively about the cosmetic services and all the other services that we provide, and and when we go to a dentist, we expect them to be able to do that. But in our practice, I really want to give people even more. There's another little bonus there, and the big bonus, it's a huge bonus because it could be life-saving. The huge bonus is we've studied extensively and intensively about certain oral conditions that can be evident that will help us even predict early who could be in trouble for things like diabetes and things like heart disease. And when you mentioned in the intro major diseases of our time, I mean, most women and men today are dying of heart disease and diabetes, and 64% of women and 50% of men have no prior symptoms. So what if you could come to your dentist, which, by the way, people who are seeing a dentist regularly see us at least 72% of the time. You're consistent. Only 50-some% of the time are people consistent with their physician. And the average time somebody goes to their physician for their yearly physical is about every 5 years. And especially if you're in your 20s and 30s, I mean, those people think they're invincible. And
sometimes they don't go for 5 or 10 years.
Yeah, and we see so much disease in that population that could be detected early and could be preventative. So what do? You come in, you have your teeth cleaned. It's a nice visit. You see us regularly. We help you not only with your dental health, but we help you with your systemic health, and we can alert you very early if you have some kind of looming issue, and it's a privileged place to be for both of us.
Very important to not take your health for granted, especially at a young age. Let's talk some more about this on the other side of the break. You're listening to the Dr. Thompson radio show, and he's here with us this afternoon to talk about the seriousness of undetected oral pathogens, which can be the root cause of many catastrophic diseases. If you have a question for the doctor, you can call him directly at 800-859-0957. Again, that number is 800-859-0957. Don't miss this opportunity to talk to the doctor directly. You're listening to the Dr. Thompson radio show on News Talk 760 WJR. And we are back.
We have another interesting opportunity too for our dentists that, like our Florida dentists and our, a little bit, I've talked to you before about our Wellness Dentistry Network, which is kind of our education hub. And we have dentists in Florida, but I'll tell you, the Floridians, with what's happened there recently with the hurricane, there's a huge mold problem because the lack of air conditioning and the water damage and now all the things that are happening in that environment. And it's really, really important. And as a dentist, I can guarantee you they're going to see an increase in oral inflammation. They're going to see an increase in other health-related issues because of this. I know that workers have been contaminated with certain pathogens and will have an overgrowth of pathogens, or maybe this imbalance of oral pathogens because of some of the environmental exposure that's happening now. So there's going to be there's amazing things that we can see. And during our first segment, we talked about looking at early metabolic issues, but there's environmental issues. There's many things that we can see if we're paying attention to what's going on in the mouth.
And how are you going about it, looking at the environmental factors? I mean, is this part of the swish and spit test where you see like an overabundance of certain things that you find in the air? How do you know that it's environmental? Yeah,
Siobhan, it's a nice question. But what happens is they just get the oral balance just gets imbalanced. And when it gets imbalanced, you start to recognize it. It usually shows up by gum bleeding, or it shows up by excessive cavities, or it shows up by some other kind of the look of the tissue or lack of saliva. There's quite a few different things that we can see that alerts us that something's not right. And then you start doing further testing. We can do yeast testing. We have a yeast test. We have the bacteria test. We have tests for viruses. So we can see different things that and I have to, as a dentist that has a medical flair to my practice, I have to go through a decision tree of what tests do I order, and I order those tests, and on most of these tests are all under a couple $100, maybe some are under 400, but I mean it's not that expensive, and and we can really find out a lot and learn a lot about people.
Yeah, it's amazing.
No other way to find out about it than to take a nosedive and take the test. And they shouldn't work.
And we're even at a point now where we're testing all new patients.
That's good. That's a great idea. Welcome back to the Dr. Doug Thompson live medical radio show here on WJR. I'm your host, Anne-Marie Cronin, and we are here this afternoon talking with Dr. Thompson, general dentist and oral health specialist in Bloomfield Hills, Michigan. He's with us discussing the latest diagnostic methods he uses to diagnose many systemic diseases, from cardiac disease to the prevention of Alzheimer's. If you have a question and you'd like to talk to the doctor directly, don't hesitate to call at 800-859-0957. Dr. Thompson, over the break, you and Siobhan were talking, and we've been talking about what you find when you look in the oral cavity. And what most listeners don't realize is that even though you go to your PCP, your primary care physician, whatever, once a year, once every so many years, they never look in your mouth other than to look at the back of your throat. I mean, and if they are looking in your mouth, they're not looking for anything specific. They're not taking specimens of the pathogen. They're not examining it under a microscope. That's not in their bailiwick of their practice. So that gets skipped over, and then it's the regular, let me listen to your heart, your lungs, see how you're breathing, feel your neck or whatever else they do in a regular physical. So that whole science of look what we found in the past, I don't know how many years, but recently, that there's this gold mine of information in your mouth that can be diagnosed, unveiled, tested to find out what the diseases are that you're going to get before you get them. So your practice is definitely one of prevention. And I think, what do you think, Siobhan?
Yeah, absolutely. I mean, and we were talking over the break, but again, I want to announce that we are on Facebook Live in the off times off the air. We have some great discussions there, but we were talking about some of the environmental factors and things that people are being exposed to that affects their overall health and the health in their mouth. And a lot of these things might go by for long periods of time. If you're living in a place where you're exposed to something that's toxic, that's really, really affecting your health. And it's so important to have it screened. And that's something that you're doing.
Yeah, and one of the big things that, if you think about toxicity in dentistry, one of the big things has been mercury toxicity. So we could talk specifically about that because we have a very nice test that tells us whether the mercury in your body is being retained, whether it's being excreted. It's usually processed through the kidneys and excreted through the urine. But if you're collecting mercury, that's a really big risk factor for Alzheimer's and dementia if you're collecting mercury in your body. And we have a really cool test that tells us whether the mercury that you have in your body, first off, it tells us how much you have, which is really nice to know. But then it tells us if the mercury that you do have has come from some kind of alloy. It's a metal, that means a metal mix in your mouth, and you might know that as like a silver filling or an amalgam filling, or if it's coming from fish. Because a lot of us, the big fish have quite a bit of mercury in them today, and there's toxins in our environment from that. So that's a really cool test, that mercury test. Back to more what Anne Marie was talking about in the beginning, and these things that we can see, these early signs that we can see in these tests that we have. And I know Anne Marie talked about how PCPs can look in your mouth; they rarely look in your mouth. And the saliva test can be very revealing. Well, what we have today is a small shift for just a few PCPs, at least in the Detroit area, that have worked with me. And I now have some physicians that are actually doing some oral bacterial testing on patients. And they send them to me. And I see these patients have a significant oral imbalance. They have high levels of high-risk pathogens. And many of these patients, almost all of them, have other medical conditions. So the reality is, even as a new patient in my practice, if we surveyed the saliva, basically by taking a small sample of it, which is painless, quick, easy, under 30 seconds, we can look at the results of that, and we can determine a lot. So there's two real kind of conversations going on here that we've been talking about on Facebook Live and here live on the radio. And, one is the environmental things that are happening in our life. The other ones are what are PCPs doing and how are we using salivary diagnostics or, the information from the saliva about the bacterial imbalance. And I can just say this, I'll summarize it in just a couple sentences. If you have high levels of dangerous pathogens living in your mouth, I can guarantee you it's affecting your health in as many as 57 different ways, and it for sure is affecting the health of your blood vessels. And all of us need good blood vessels so our hearts can beat properly and our brains can think properly. So it's a huge opportunity for us in dentistry.
It's a huge opportunity for the entire American population. Let's be serious about it. And when you said, 57, that's at the low end. It could be a lot more.
No, for sure. When I first got out of dental school, it was diabetes and heart disease, and now it's up to 57 different diseases.
And imagine, I don't mean to interrupt you, but what's amazing is that you're talking about when you got out of dental school. How long have you been practicing?
Well, I've been practicing 26 years now. So when I got out of dental school, we just knew there was some connection. But even my young colleague that is, Dr. Watkins has been on the show. There's basically almost nothing mentioned in school about this whole arena, and it's something that we've worked really hard with physicians to learn about.
And it's pretty amazing that there was this loss of information that, we had all this, you knew about, there were bacteria in the mouth and the oral cavity that led to diseases, but now we've nailed it, that everybody knows even what they are. And we also know that once you get Alzheimer's, there's no turning back. That's a horrible long death, and you can't cure it. There's no resources to cut it out or take it away. You've got it, you live with it, and everyone else lives with it. Horrible disease. And the facts speak for themselves. 700,000 men died last year, according to the CDC, of the widowmaker, which continues, the numbers continue to go up. And here we've got this valuable resource of finding out how we can prevent these diseases by resorting to specialists like Dr. Thompson, who are looking in the oral cavity first before they look at your teeth, before they look at your gums, before they look at anything else that's going on. They're looking at what is hidden in here, that if left in here and if we don't get rid of it, it's going to lead to some serious problems. And my next question is, you're taking the saliva test, you're coming up with the results. Can you get rid of that deadly bacteria?
Absolutely. Absolutely. I have patients that this test first came out in 2009, so as many as 13 years ago, I was looking at patients' saliva, and I had to come up with a formula for how to treat them. And what I learned, Anne-Marie, is what I was taught in dental school wasn't getting the job done effectively. It just wasn't getting the job done effectively when you remeasure the bacterial test results. So we put our heads together with some microbiologists, with some people who developed some significant oral rinses, and we came up with a very significant protocol. And it's been published in several publications as either the IOM way, that stands for Integrative Oral Medicine, that's the name of my practice, or it's been called sometimes the Doug Thompson Disinfection Protocol. But it's a protocol that actually eliminates the high-risk pathogens. And once we teach patients what to do and what to use, they can keep the exposure to those pathogens either eliminated or very, very low for years. So I have patients out now 13 years that I've been testing and retesting, and they've never had the levels of bacteria that they had in the initial disease presentation ever again in 13 years. And the only thing they've had is gum disease maintenance in our office, and they had the treatment one time. And
that's really pretty amazing to think about, the fact that these deadly diseases, crippling diseases, and diseases for which there is no turning back once you get them, can be diagnosed in the oral cavity, and that you've got a way of getting rid of the pathogens so they never get into the bloodstream, so they don't connect to the very bad diseases that are out there that we're all afraid of, because everybody's afraid of heart attack, stroke, and all these deadly diseases. And here you've just got to find a dentist like yourself who is doing prevention.
Yeah, and the big thing that's difficult for a lot of people is they all think they're fine. Everybody thinks they're fine. Well, I can tell you almost 60% of the population is going to have some significant issue. Everybody thinks they're fine, and one of the problems with being fine is even though you could have high levels of pathogens, sometimes it just doesn't hurt. And if when you had high levels of pathogens, it was painful, that would be beautiful, because more people would be healthy, and we wouldn't have people dying every 34 seconds of a heart attack or a stroke.
Right, at least they'd have a signal. Well, we're going to have to take a quick break and come back and talk to the doctor about this after the break. The importance of diagnosing and treating gum disease, and how essential it is, and how it can prevent some of the major diseases of our time. If you've got a question, you can talk to the doctor directly at 800-859-0957. Don't miss this opportunity to talk to Dr. Thompson directly. You're listening to the Dr. Thompson Radio Show on News Talk 760 WJR.
Yeah, I think the protocol is super interesting, because we've talked about people having to get the laser therapy, and it sounds to me like there are alternatives, because that's obviously very expensive. So I think knowing that you have this sort of specialized treatment plan is huge, because, I think it's also more of I don't want to say a cost savings, but it's less costly than some of the more
advanced treatments,
to basically accomplish more or less the same thing.
Yeah, and I think, Siobhan, it's probably a nice thing to talk about, because I can probably explain that a little bit, because some of this disease management is very expensive, and especially if you use expensive equipment like a laser. Now, interestingly, when I was developing the protocol back in 2010, 2012, there were companies that were going around charging dentists less than $100,000, but more than $50,000 to learn how to control this disease. And I was controlling it for $6,000 or less. And what they were doing is they were telling you that you had to have a laser as part of your disease treatment protocol. Well, I've proved conclusively through patient after patient, looking at pre and post test results, which very few dentists ever do, measure pre and post. I measure both. And I found out you don't need to have a laser. It's an adjunctive therapy. And the reason why a laser is helpful is because, or could be helpful, is because of the reach and the expansiveness of what the laser can do for you. However, you don't need to have it to be successful. So a lot of patients or a lot of dentists already have what they need. They don't need $60,000, $100,000 worth of laser equipment. Does that help? Oh, sure, it helps if you have it, but do you need it? No. And my protocol was laser-free, and I've actually only added a laser to my practice in the last year. So that means for the last 13, 14 years, I've been working without a laser, and I did it to prove conclusively that you don't need a laser to be successful. We already know how to do that.
That's a tremendous point, when you stop and think about it, because obviously he's talking about the Lanap procedure and Lanap therapy through the laser.
Expensive, so I think
very
a lot of
expensive.
People probably get stuck, they're like, well, I know that I have this issue and this is what the treatment costs, and it could be prohibitive,
There's no question.
And I think nobody's asking, once you diagnose these pathogens, once you see that they're there, isn't there an alternative? Because other than in your practice, nobody's saying, well, yeah, we could treat you with medications or mouthwashes or whatever the treatment protocol is, and then let's take a look in 3 months or 2 months or at the end to see where you're at then, before we take a nosedive. Although obviously Dr. Thompson's got Lanap laser and can do that as well if need be. But again, right. It's an end choice, right?
Yes, and I just don't want to make it all about Lanap, because it's not all about Lanap. It's
not even about Lanap with you.
It's called total mouth disinfection, and
right.
Lanap only focuses around the teeth.
Yeah, that's right.
Yeah, we should really emphasize that, I think.
Yes.
Yeah, I'm happy to talk about the protocols. I'm happy to talk about how that happens, but people need to know, and for our Facebook listeners, we'd love to have some questions about the process, but it's really, it's very pain-free and it's very effective, and it can be way less expensive. It's very, very often under $5,000 for treatment if you're diseased.
Right. Welcome back to the special edition of the Dr. Thompson radio show. I'm your host, Anne-Marie Cronin, and we are talking with the doctor, dentist and pioneer in prevention from Bloomfield Hills, Michigan. He's here this afternoon explaining the medical diagnostic model he incorporates in his clinic to screen for many of the catastrophic diseases, from cardiac disease to Alzheimer's, that through early detection can be prevented. If you have a question for the doctor on this topic we're discussing today, please call us at 800-859-0957. And before we come back to Dr. Thompson carrying on about his disease protocols, which is very interesting and we need to know about it, Siobhan, tell the listeners once again about why Facebook Live is so important, because over the break we have the best discussions.
Yeah, I mean, for anyone that's listening on the air, I really encourage you to go to the WJR Facebook page and listen there as well, because over the break we do have a lot of extended, discussions about some of the additional things that Dr. Thompson's doing and just other health-related aspects. So it's a great way also to tune in and ask questions. If you don't want to call the radio station, you can always send them through Facebook. It helps kind of guide our discussion in some cases too. So I really encourage people to tune in there.
Right, and it's also on my Facebook Live page if they don't remember WJR's call letters. But let's come back and talk to Dr. Thompson about the protocols you use in your practice.
Yeah, the protocol, back when I developed the protocol to get rid of the harmful bacteria, first you have to measure them. And then when you see that they're elevated, the first thing you want to do, and when I put the test is typically colored and it's graphic. And when I put the test in front of patients, they usually look at me and say, well, what do I have to do to get rid of this? And well, that's the magic question, because in dentistry, 12 years ago, 13 years ago, there were groups going around teaching dentists how to eliminate the pathogen load in people's mouths, and they said you had to have a laser. You had to have, certain type of equipment. And what I proved conclusively was you don't need that kind of equipment to be successful. You could do it with a very intense protocol that this basically has two parts. There's an office component to it, and there's a home component to it. So we needed to do certain things in the office, but we needed patients to shift their hygiene protocol to maybe not just brushing and flossing. Maybe they had to use a rinse, or maybe they had to use a special paste, or maybe they had to do a couple other things. But it's all relatively easy. And the difference between the protocol that we developed and the laser protocol could be as much as $5,000 to $10,000. I mean, it was very expensive. So I wasn't looking for a less expensive alternative. I was looking for an effective alternative. And what I realized and learned is that we have to disinfect the total mouth. So think about the difference between the total mouth, which includes the cheeks, the tonsils, the tongue, other areas of the mouth other than just the teeth. And the problem with the laser is it focused only on the teeth. So it was a nice adjunctive therapy for us to use, but the total mouth disinfection protocol is much, much more than that. So let me summarize what it is. It's simple. It's usually less than, our most expensive therapy in the office is maybe $6,700. So it's usually typically under $5,000. It can be done very nicely for anybody that's infected. It's a series of appointments, but it's a total mouth disinfection protocol that rebalances and restabilizes health. And then the patient themselves we teach them what to do at home, so they don't need us as much after that. They need us for evaluation, but they don't need us to make them healthy. They're keeping themselves healthy by what they do at home. And that's really refreshing to be able to do that.
Well, we certainly know you've got a broad spectrum of treatment protocols, and you threw out some big numbers out there that might be scaring some people off. But what I would like to say is, all listeners, no matter what level of financial, capabilities you have, I still go back to the concept of prevention. Dr. Thompson and very few other dentists are looking in the oral cavity. Your doctor, your PCP, your physicians are not. So you have this opportunity to be able to go in and get relatively inexpensive diagnostic tests, even if they're not covered by insurance. These tests are a couple of $100s, the initial tests.
Correct.
And then you can decide where you want to go from there. It's not like you're going to dive in the deep end and all of a sudden I'm going to be out of pocket. I would say everybody, I think, ought to go in and have this salivary examination and look and see what is in my mouth that can cause really serious, devastating disease. And that's simple, stupid, and that's not that expensive to do that salivary test.
No, it's very easy to do the salivary test, and I do have $200 options. I have under $400 options for more extensive testing. We have a lot of things we can do. But, I'm sorry to throw out some numbers, but I wanted people to have some idea. Sometimes when I talk to patients and I tell them it's, $4,000, they go, oh my gosh, thank God, I thought it was going to be $20,000. And then I talk to other patients, say it's going to be $4,000. Say, oh my gosh, if I spend over $500, my wife's going to kill me. Or
Right.
So, I get that part. And we figure out, we like to figure out what patients can do, but, what patients, want to do. But what I'm trying to do is just, let's create a comparison. It costs $250,000. That's $250,000 to have a stroke, right? So if I can prevent a stroke, if I can prevent a stroke for $4,000, and that costs $250,000, and you might be looking at a bare ceiling for the rest of your life,
right?
On your back. And so come on. You want to get your mouth analyzed and figure out if there's anything in there that's causing a much higher risk for a significant disease. And then what are we up to? 57 diseases. I see it all the time. People with cancers and people with early heart attacks, early strokes, diabetes. And I beg them. I said, I wish you would have been more serious about your oral care.
Well,
I
it's
wish
also about changing, not to interrupt you, but it's about changing how people think about healthcare. It's like we look at our cars and we buy car insurance and we know we have to do oil changes, we have to fill up the gas, we have to do certain routine things, to help prevent a major
for
breakdown.
sure.
But somehow in health, there's this gap of thinking that doesn't also apply. And I think that's exactly what this is. You're right. It is immensely costly. And I'm sure 100% of the people that either have a heart attack or stroke or get Alzheimer's could wish that they could go back and have done some of this testing.
Yeah, there's no
So,
question. And again, 72% of us are going regularly anyways. So, man, why not just go to a person who gets it and who understands it and who could help you in that way? It could be so revealing. The challenges were very early in this message, and not a lot of doctors and people in our listening audience know about it. And that's the idea behind this radio show. I mean, this idea behind this radio show is to create awareness about an opportunity for you to be healthier than ever, and you can discover health issues simply by having a dentist, which you need anyways for routine care. Just be a little bit more savvy about what they can do to detect conditions in the mouth that can be very predictive of big-time health problems. And that's what I'm here for.
I mean, we've had certainly some big names in this city that have had major strokes, and I'm sure if they were able to look back and say, and they were people with significant means, that for $400 or $500 to take a look at what's inside your mouth, I'm sure they would have jumped at it if they could turn the clock back. And no one wants to wind up in the ER with, heart problems. And once that diagnosis of diabetes is there isn't any turning back on that either. And then you're like tethered to medication and problems that lead to other problems that get worse and worse, and they're all interconnected. So, I believe, and it's always been my belief, that everybody should go and get this salivary test. You have nothing to lose, everything to gain. It's all about your doctor's not going to do it. And it's finding a needle in a haystack. There's Dr. Thompson and a few other doctors, but there's just not that many dentists that are doing this. And we're just very fortunate that you took on this in your life as life's work.
Well, it's become my passion, and it's become, what I want to do. And I just love when patients get up out of my chair and they say, I've never been examined like that before in my life, or they say, it's unbelievable that I can have a more intelligent or a more sophisticated or a more in-depth conversation with my dentist about my overall health and my oral health than I can with my physician. And it's a very privileged place to be. I'm very compassionate about it, but I'm also very respectful, and I'm very humbled by what we can do. And so it's super important, and I would love to help any of our listening audience.
Not to mention they get the bonus of a 1-hour interview the first time they're going in your door. But let's come back and talk about that on the other side of the break. You're listening to the Dr. Thompson radio show, where we're talking about oral health and disease prevention. If you have a question, you can talk to the doctor directly by dialing 800-859-0957. Again, that number is 800-859-0957. Don't miss your chance to talk to the doctor directly. You're listening to the Dr. Thompson radio show on 760 WJR.
okay, back on Facebook.
Back on Facebook, where all the interesting comments come up and all the interesting discussion comes up. But yeah, I mean, I was thinking as you were talking and throwing out 6,000, 10,000, that everybody was going, okay, turn the radio off.
Yeah.
No, but more importantly, saying the cost of actually having one of these catastrophic events really puts it in perspective, because it's true. I mean, the cost down the line is immense.
Right.
No question. And I do hate to talk about, big numbers, but it's interesting because some of the people that come in and sit down and I tell them, why do I need this test? Or, okay, just do it. Okay, just do it. Just do it. And so, we spend more money on dinners, and we spend more money on, one night out to a local, not even a super sophisticated restaurant. It's going to be way more than what the salivary diagnostic test costs.
Right.
So.
And, just stop and think about it. And plus the fact that it's simple, it's short, it's non-invasive. You don't need, people are always worried about needles. They're always, is it going to hurt? I'm worried about a needle. I'm worried about, is he going to cut into my gums? I mean, it's like, it's a very simple, extracting some salivary mucus and then just looking at it and getting it examined and then finding out. And we've got the possibility to do it now. And the other myth that's out there are all the young people that walk around thinking I'm healthy, I go to the gym and I'm vegan and I eat all the right foods and I have no pains, no aches. It's like most of these diseases don't have warning signs.
Yeah, and the diseases are approaching us differently today. So
Right.
again, everybody has one of these, right? Everybody has one of these cell phones for probably less than or somewhat equivalent to my monthly cell phone bill. You can get something.
sure.
You can get something. You can get something that could be life-saving. So,
Yeah, I mean, it's just a matter of people have got to start thinking on a different button, instead of we're so like baked into the Blue Cross model or the insurance model of, and even dental insurance, I hate to say it. It's so pathetic what they allow, the best of companies allow for dental insurance, and everybody thinks that's great. I can get 3 fillings for that, or I can get 1 crown.
I mean,
for
they
that.
established those fee tables in the 70s.
That's really, it's pathetic. It's unbelievable.
And there's still, it's really like just like a coupon. I mean, if you have dental insurance, it's unlike medical insurance. If you have medical insurance and you have rising medical costs, the insurance keeps working for you. In dentistry, you have a limited amount of money that's available. It's like a coupon. And then what the dental administrators or the insurance administrators do is they basically, the more they hold, the more money they hold, the more money they hold back for the companies, they do great.
Yeah.
Did you ever go into a downtown area of any downtown area where there's tall buildings? You typically look at the tops of those buildings. They say things like, Aetna, MetLife,
like
Delta.
Delta
They don't
Dental.
say Doug Thompson Dentistry. I mean,
That's
that's
for
not what
sure.
they say.
You're not on the big buildings.
We did get a caller, by the way, before we go back on the air. So
All right.
I want to take the call.
And this is our last
That's funny,
segment. That is funny. No, you're right. But it probably ought to. I mean, it ought to probably say that
Yeah, it should.
because you're certainly doing a lot more than Delta Dental's doing. That's for sure. Anyway, we are at the last segment.
Okay.
Welcome back to the last segment of the special live edition of the Dr. Thompson Radio Show. I'm your host, Anne-Marie Cronin, and we are here this afternoon talking with Dr. Thompson about his state-of-the-art clinic and his practice of prevention. This is our final segment, so if you have a question for the doctor on the topics we're discussing today, please call us at 800-859-0957. And Siobhan, I'm coming to you. You have a caller?
We do. We have Paul in Commerce Township on the line. Paul, what's your question?
Well, I'm curious as to what kind of tests that this dentist could do that would cost $5,000.
It's not a test. Yeah, it's not. Go ahead, Dr. Thompson.
Yeah, Paul, I just want to clarify, there's no test that costs $5,000 that I do. Most of the tests that I do are under $375, so they're very inexpensive. What I think you might have heard is we were talking about some numbers, and Paul, this might have been an error on my part to start throwing numbers out there about treatment, but I was trying to create a comparison between what the cost of disease prevention treatment would be versus the cost of having a catastrophic event like a stroke or a heart attack or getting diabetes. If you have diabetes, it's going to cost you a certain amount of money per month to maintain your medication and even just to maintain your life and your existence. So I hope there was no confusion, but I want to be clear. And Paul, thanks for giving me the opportunity to clarify. None of the tests that I have cost anywhere near $5,000. Most of them are under $400, and many of them are under $200. But what we do have are treatment packages and stabilization packages, or disease packages where we can get people on a road toward health for under $5,000. So no test costs $5,000. But treatment should be relatively manageable. We have payment plans. We have ways to have people help pay for that so that they're not paying for it all at one time. So I appreciate your question, and I hope that gives some clarification.
Yeah, very well said. That does, because sometimes people just hear figures. That's why when we were on Facebook Live, I was certainly saying, whoa, once you throw out a figure there, that's what wakes people up. They hear that number and they're like, oh, what did they say? What was it going to cost? And then they don't know what it's connected to. So,
Yeah, and plus,
but I understand what you were doing.
And plus, I was just trying to give the listening audience some idea, because again, some people, they have no idea. Is it going to cost as much as a car, or is it going to cost as much as a couple nights out? So I needed to make sure there was some comparison. And so what I don't want to do is all treatment plans, all disease prevention and disease monitoring plans in our practice are personalized for you. So there's no set, it's not like a menu where you come in and there's a set fee. We have to do an assessment. We take a test. We look at your particular condition. We also look at your particular financial capability. And some people need help with financing. Some people can do it on their own. And so we make sure that we take care of everybody based on their personal needs.
And once again, I always like to harp on about the same thing and you brought the point clearly in the last segment. If we were to take a look at the figures of treating 10 years worth of Alzheimer's, as you said, looking at the ceiling, or the cost of dealing with a heart bypass surgery and the consequences after that, the life after that, or just being tethered to a life with diabetes, or some of these horrible diseases that once you get them, now you're chained. You're just chained for the rest of your life. You're chained to pharma and you're chained to living with this disease. And here we're saying, okay, you can come in and we're going to take a swish of saliva out of your mouth and take a look at it for a couple $100. It's up to you where you go from there. It's up to the patient where they go from there. Because you're telling me I've got this bacteria that can cause Alzheimer's or diabetes or heart disease. Now it's up to me to take the next step and maybe get in touch with my doctor and move on and see. But at least I know. At least I know it's there. And that's why, my mantra has always been, everybody out there who's listening, they should all be lining up and getting this salivary test. What do you say, Siobhan?
Yeah, absolutely. I mean, I think it's essential, and it is very affordable. I mean, the testing just to know where you're at is, incredibly affordable and worth it. I can't imagine anyone not doing it.
And that's the problem. That's the issue that I have a big concern about, is that I want to give people the opportunity to choose. If I don't give you the opportunity to choose, if you come in and I just say, oh yeah, everything's fine, you look great. I look at your gums, I look at your mouth, and I don't really do any kind of in-depth analysis and just go by what my eyes see, and I say, oh yeah, it looks great. You will not believe the amount of disease that we discover by doing testing when our eyes fool us and think that everything's just fine. So even on younger people. So that's why I think, we're entering an era where all of us are going to get our saliva sampled, and we're going to learn many, many, many things from the saliva results and from those from the test results. And again, they're getting less and less expensive. It's something we can do now, and I want everybody to have the opportunity to choose health if they wish to. I know some people just want to sweep it under the carpet and say, well, I'll take my chances, but I don't want that to be you if that's not what you want for yourself.
That's a risky business, and I wouldn't go for it. I'm still saying get the test done. But before we run out of time, we are in the last segment, and for the rest of the listening audience, Dr. Thompson, other than prevention, which is amazing, the work that you're doing in prevention, tell us about what else you do in your practice.
Well, I mean, we do all the traditional dental stuff, crowns and bridges and implants and dentures and partial dentures and restore teeth and restore smiles. And again, we had a whole segment dedicated to some of the cosmetic services, but I have people who used to have beautiful smiles and now they have broken teeth, worn down teeth, chipped teeth, flaring teeth, moving teeth. They have all kinds of problems where we can create a smile they used to have, or some people come in and say, I always wanted to look like this, and now we're creating a smile that they never had, and we can create that for them. So we can do all the traditional dental services, but as I have stated so clearly in the past, and I want to state again, that we love to create beautiful smiles. We love to repair teeth and make sure teeth can maintain as much integrity as possible from some of these diseases or some of these issues as they break down. We can repair them. But what we really want is we want the people who have these beautiful smiles to be as healthy as they can be. And that's really easy today for the dentist to help them be that way. And that's what our practice is all about at Integrative Oral Medicine.
And once again, unfortunately, not all dentists are doing it, and no doctors are doing it. So you're not going to go to your PCP and ask for, let's take a look at my mouth and tell me what's going on. That just doesn't exist in primary care or any other subcategory or specialty of medicine. So we're lucky that dentists such as yourself have taken this on, and that we have the possibility now through technology to do this type of diagnostic work. It's pretty amazing to look in your mouth and find out, I've got the pathogens that cause Alzheimer's, that could lead to diabetes, that could lead to cardiac disease, and we can get rid of it.
Yeah, and if you come into the practice or you think that it's not you, or you don't have this problem, I mean, think about your family members and think about your significant other,
right,
and think about other people in your life, because that's a big thing that happens to me. I see somebody that in the practice, they're doing a beautiful job with their health and they're very stable. And they say, oh, my brother's having a big problem with this, or my mom's having a big problem with this. And so there's other people. It might not be you. If it's not you, it could be others. We'd be happy to see them. We want everybody to be healthy, and we don't want your oral health to contribute in a negative way to your overall health. And that's what Integrative Oral Medicine is all about. So come see us. We'd love to take care of you, and we'd love to test you and see what's going on.
All about prevention. So unfortunately, we're out of time, and that wraps it up for the Dr. Thompson radio show on 760 WJR, sponsored by Integrative Oral Medicine. I'm your host, Anne-Marie Cronin, and again, I want to thank Dr. Thompson for talking to us today about taking charge of our health, being proactive, and avoiding the devastating results of undiagnosed oral pathogens. Thanks also to my co-host, Siobhan Cronin. To learn more about Dr. Thompson's practice, you can reach him directly at 248-642-1000. Again, that's 248-642-1000, or by visiting him on the web at ioralmed.com. Again, that's ioralmed.com. We hope that you've enjoyed this special show and that you've become more informed about oral health and its impact on the major diseases of our time. Thank you for listening, and be well.
Opinions heard in the preceding program are those of the host and guests.
Right.
Thanks, Siobhan.
Thanks,
Yeah,
Siobhan.
thank you,
Media
guys.
or WJR
Where's-
I don't know
Radio.
if Ashley
Once again,
Ashley.
760 WJR presents Christmas
writing
on
from
Us
Indonesia.
to
I
celebrate
Indonesia?
actual